everyone and welcome to my video lecture. So yesterday we had completed with blood pressure, right? And today we are going to start with the topic which is measurement of blood pressure. Okay, so before we begin with this part, I forgot to tell you one thing in yesterday's lecture, and that was about the high blood pressure and low blood pressure. Please remember, high blood pressure is also called as hypertension. Okay, so I forgot to tell you that in yesterday's lecture. And low blood pressure is called as hypotension. Okay, so always remember that high blood pressure is hypertension, low blood pressure is hypotension. And what is the ideal blood pressure? It is 120 by 80 millimeters of mercury. Okay, now let us start with this part which deals with measurement of blood pressure. Now I am sure all of you must have learned about this instrument in your school. Which is the instrument which is used to measure blood pressure? It is called as syphgmomanometer. Alright, syphgmomanometer. This is the name of the instrument which is used to measure blood pressure. Some of you might have seen it, some of you might not have seen it. The diagram is given in your textbook. Alright, now basically you have to understand how this instrument works, that is given in the book. So the syphgmomanometer is basically a machine which is used to measure blood pressure, and it has got many different parts. For example, one of the parts is called as a cuff. Okay, cuff is the part which is tied around your upper arm. Okay, and cuff is basically a rubber bag and it is surrounded by cloth. So वो जो चीज आपके ऊपर यहाँ पे बांधते हैं ना ब्लड प्रेशर मेजर करते हो, उसको बोलते हैं कफ. रबर बैग का है and it is surrounded by cloth. That is one of the parts. Now this cuff is connected by tubes on both the ends. Okay, so one of the tubes is connected to the machine which is called as the manometer. Manometer is that machine where that mercury is there. Okay, and as the pressure rises you can see the mercury levels going up, as it drops you can see the mercury going down. So that entire machine which is calibrated, that is called as the mercury manometer. So cuff ka ek end jo hai, it is connected to that manometer, right? That instrument which has mercury and all the calibrations, it is called as the mercury manometer. And the other end of the cuff is connected to a rubber bulb. So you must have seen that rubber bulb is pressed to increase the pressure, and also on the rubber bulb there is a screw mechanism by which you can release the pressure. So the other end of the cuff is attached to a rubber bulb. Okay, and that rubber bulb has a pressure increasing / decreasing mechanism. Is this clear? Okay. So now how do you use this to measure blood pressure? So what happens is, first of all, this cuff which is having a velcro ending, okay, so it is basically wrapped around your upper arm, not your lower arm, the upper arm, this part. Okay, because basically what you want to do is you want to stop the brachial artery for a brief amount of time, and the brachial artery is passing through this. आपको ये स्टॉप करना है जो यहाँ से ब्रेकियल आर्टरी जा रहा है, तो आप वो रैप करोगे कफ को, ठीक है, वेलक्रो से वो अटैच हो जाएगा. Then what the person or the doctor does is, this rubber bulb which is present, I think you must have seen it, the bulb is something like this, and there is a screw mechanism over here. So this bulb, obviously it has a tube, it is connected to the cuff. So the doctor keeps on pressing this bulb, and because of that what happens is, this cuff gets filled with air. Obviously वो press करेंगे तो cuff fill होगा, and because that cuff is already wrapped around your upper arm, that air will fill inside the rubber cuff, and what will happen is that cuff will exert pressure on your biceps. आप समझ रहे हो? तो ये पूरा आपके ऊपर ऐसे tightly होते जाएगा, and because of that pressure what will happen is, the doctor will keep on doing it till the pressure increases so much that the pressure of the cuff, ये जो cuff का pressure है वो आपके systolic pressure जितना है तब तक या उससे भी ज्यादा. So what happens is, when the cuff becomes very tightly wrapped, tight क्यों हो रहा है समझ रहे हैं, उसके अंदर air भर रहा है तो वो आपके ऊपर ऐसा tightly clamp करेगा. So at one point the pressure in the cuff will become so much that it will exert pressure on the brachial artery. Brachial artery is passing through your upper arm. I have already told you that. And because of this external pressure, that brachial artery will get blocked. So blood supply will stop. Blood इधर से जो इधर जा रहा है वो बंद हो जाएगा because of that external pressure. Now, once that pressure is reached, what the doctor will do or the person who is taking the blood pressure, what he or she will do is slowly the pressure will be released. So यहाँ से screw थोड़ा untighten करेंगे. So as soon as the pressure is released, what will happen? Air from the cuff will be released. So यहाँ पे थोड़ा लूज हो जाएगा आपको, and this will be continued. So the pressure will be released until a sound is heard. Okay, and that sound is called as pulsatile sound. Pulsatile sound is the sound of the pulse. So देखो क्या हो रहा है मैं समझा रहा हूँ. So what is happening is already you have increased the air inside the cuffs, and those cuffs are exerting pressure on your brachial artery, and at one time the pressure, the external pressure is so much that it stops the flow of blood in the brachial artery, it gets blocked. So you feel that heaviness over here because blood is not going in your forearm. That pressure is approximately very high compared to your systolic pressure. Now what will happen is, as soon as the screw is opened, the pressure is released slowly, and at one time what will happen is the pressure will match the systolic pressure. Systolic pressure is how much? 120. And because of that, what happens is the blood starts flowing again, but still there is pressure from outside, and because of that, when the blood flows, there are certain sounds which are heard. Okay, and that first sound which is heard, that at that time the reading on the manometer is recorded, and that pressure is called as the systolic pressure. तो आपका जो ब्लड फ्लो बंद हो गया था, वो चालू करने के लिए आपको यहां से रिलीज करना है. ये प्रेशर आपने रिलीज के अंदर थोड़ा लूज होगा, वो कब तक करना है? जब तक आपको ब्लड का कुछ अलग सा साउंड नहीं आता फ्लो होने का. As soon as you hear that sound for the first time, you stop releasing the pressure and you note the reading in the manometer, and that reading is called as your systolic pressure, and the normal systolic pressure is 120. हो गया? Correct? Now, after you note down that reading, again you begin to decrease the pressure. So इसको और open करो, तो इधर का pressure ये जो बाहर का है वो और कम होगा. And then what will happen is there will be a point where you will stop hearing the flow of the blood. वो जो abnormal sounds आ रहे हैं, that will stop completely, because now at one point the pressure will be completely gone. And because of that, what will happen is when the pressure will be completely gone, that those abnormal sounds which are coming, they will also be gone, and as soon as the sound of the blood flow stops, again that pressure is recorded, and that pressure is called as the diastolic pressure. Both the readings are taken. So the first reading for a normal person will be around 120, the second reading will be around 80. So systolic pressure SP upon diastolic pressure, that is your blood pressure. Very simple. Is this clear? The sounds which are heard during measurement of blood pressure, these sounds are called as Korot-Koff sounds. Okay, these are given a separate name, Korot-Koff sounds. Korot-Koff is the name of the Russian scientist who discovered these sounds during taking of blood pressure. So these sounds which are generated, example, when you get this first reading, that sound which is generated because of blood flow, because some resistance is there from the cuffs, so that sound which you hear and you take the first reading, that is called Korot-Koff sounds. When you take this second reading, the Korot-Koff sound has disappeared. देखो याद रखना है, पहले रीडिंग में जैसे ही वो abnormal sounds ब्लड फ्लो स्टार्ट होता है उसके आते हैं, वो फर्स्ट रीडिंग है ब्लड प्रेशर का, एंड सेकेंड रीडिंग इज टेकन एज सून एज दोस abnormal साउंड स्टॉप. सो यहाँ पे Korot-Koff साउंड स्टॉप हो रहा है तब आप रीडिंग ले रहे हो, दैट इज दिस diastolic pressure, systolic pressure. So when you take the first reading, your cuff's external pressure is exactly equal to the systolic pressure. When you take this second reading, the cuff's external pressure is exactly equal to your diastolic pressure. ये समझ रहे हैं आपको? ये क्लियर है? ये वो साइंटिस्ट का नाम है जिसने वो साउंड डिस्कवर किए थे. So that is your measurement of blood pressure. Is this clear? Alright guys, so I hope this part is clear. So we have finished with the first part of today's lecture, which is measurement of blood pressure. Now our next part which we are going to learn is about the disorders, okay, and we are going to start with hypertension, then we are going to start with coronary artery disease and angina pectoris. There are some parts which have been deleted from your syllabus. For example, silent heart attack they have removed, heart transplant they have removed, angiography they have removed. So I am not going to record that in this lecture. If you want those parts, then I will make a separate lecture, but they are not there for this year's 12th standard syllabus. So after this, we are going to start with the three disorders: hypertension, CAD, and angina pectoris, and finally we are going to end with ECG. Okay, so that is going to be our today's lecture. If you want, you can write this down in your book. Okay, and then we will start with the next part, which is related to disorders. Okay. Alright guys, so let us start with the next part. Next part is related to disorders. And the first disorder which is given in your book is called as hypertension. So you must have heard of this term high blood pressure, hypertension a lot, right? I don't think there is anybody who is listening to this lecture or who is watching this lecture who doesn't know what is high blood pressure. So high blood pressure is also called as hyper. Hyper means more and hypo means less. Hypertension is also high blood pressure. Now I have already told you what value is considered as high blood pressure. So value which is above 140 by 90 millimeters of mercury. Okay, see your normal pressure, again I am repeating this, 120 by 80 millimeters of mercury is called as normal pressure. Pressure of 140 by 90 millimeters of mercury is called as high blood pressure. Okay. High blood pressure is caused by what? That also we have studied in yesterday's lectures. Many factors. Age is a factor, viscosity of blood is a factor, diameter of the arteries is a factor. Correct? So there are many factors which can increase the blood pressure, but this is called as high blood pressure. And in extreme cases, the blood pressure may go as high as 180 by 120 millimeters of mercury. Just imagine, normal 120 का systolic pressure है, that is becoming 180, and 80 का diastolic pressure is becoming 120. This is called as extremely high blood pressure. Okay, and this is very dangerous for the body. See, this is also dangerous, but this is very dangerous because such a high blood pressure can basically cause damage to three organs, and those three organs are the most important. It can cause damage to the brain, it can cause damage to the heart, and it can also cause damage to your kidneys. Are you getting my point? Okay. First of all, how will hypertension occur? Very simple. When the diameter of your arteries is becoming smaller. Okay. So if this is your lumen, correct? So now let us just revise. Fatak se arteries ke layers, if you remember, this is lumen. Then the innermost layer is called as what? Tunica interna. Okay. Then the most important part, that is the tunica media, muscular layer. And after the outermost layer is called as tunica externa or tunica adventitia, and this is tunica intima. Now, if this diameter for some reason, suppose if this diameter becomes less, ये lumen के अंदर suppose कोई चीज deposit हो जाती है, okay? Suppose if there is fat or cholesterol which gets deposited over here, then what will happen? The diameter will reduce, so blood ज़्यादा pressure से flow करेगा. So there are many causes for high blood pressure, but if the pressure becomes so high, then it can cause permanent damage to your organs. How will it damage brain? पहले बात तो इतना high pressure है, तो this blood is flowing through all the arteries. Now the problem with brain is the arteries which are going to your brain, those arteries are not very strong. See, the arteries which are passing through your limbs, through your chest, through your girdles, those arteries are very strong, and उनको surrounding tissue भी रहता है. So what happens is, even if the pressure rises ना, these arteries can tolerate that high pressure. However, the arteries in the brain, they are not protected by the surrounding tissue, so they can only tolerate a limited increase in pressure. अगर इतना high pressure हो जाता है, तो those arteries they cannot tolerate it, and what happens is they burst. So what will happen? Just imagine, this pressure will cause the arteries in your brain to burst, and there will be bleeding in your brain. That is called as hemorrhage. Okay, that is called as hemorrhage. Hemorrhage means bleeding. I will write down the word for you if you want. Please remember, whenever we talk about bleeding, a better word or a medical word to use is hemorrhage. HAEMORRHAGE. Hemorrhage मतलब bleeding. कोई भी blood vessel break हो रहा है and blood is leaking out. So are you understanding? So brain में there will be hemorrhage, there will be bleeding. What will happen to the heart? Now, normally when there is a high blood pressure, those people also have a higher heart rate. See, faster your heart rate, more will be the blood pressure. Slower your heart rate, less will be your blood pressure. ये तो समझ रहे हैं आपको? Pulse अगर आपका ज़्यादा है, suppose if a person's pulse is 70 beats per minute. Suppose he has a blood pressure of 120 millimeters by 80 millimeters. There is another person who is having a pulse rate of 95. He might have a pressure of 140 by 90. So pulse rate and blood pressure are directly proportional. More pulse rate, more blood pressure. Less pulse rate, less blood pressure. So what happens is, in people having very high blood pressure, the heart is beating so fast that they might have a pulse rate of say 100 beats per minute. So problem is, क्या हो रहा है? The heart also requires blood. The heart gets oxygenated blood through the coronary arteries. But here the heart is pumping so fast कि heart efficiently काम नहीं कर पा रहा है. Already the arteries have become narrow. That is why the blood pressure is increased. Plus the heart has to supply that oxygenated blood to all the parts of the body. It has to beat also fast. So what happens is, the heart itself will not get enough oxygenated blood. And because of that, you will feel pain in the chest. Okay, that is the first sign of a heart attack, and that pain is called as angina pectoris. Okay, I will explain this because we have to study angina pectoris. Angina is pain, pectoris is pectoral area, pectoral girdle, pectoral area is the chest area. Pain in the chest area is called as angina pectoris. So what is happening is that extremely high blood pressure, extremely high pulse rate is not giving enough oxygenated blood to the heart, क्योंकि heart बहुत जल्दी से pump कर रहा है. It is trying to give blood to all the parts of the body, but it itself is not getting enough blood. So what will happen? The cardiac cells will not receive oxygen, so they will begin to die slowly, and because of that you will get pain in the chest because your heart is located in the chest. You remember mediastinum, and because of that the condition which will occur is called angina pectoris. If this is not cured, or if a person doesn't take medication, or if he doesn't go to the hospital to get this checked, then this can cause a fatal heart attack. Fatal matlab death. And that severe heart attack which causes death is called as myocardial infarction. Now this chapter has got a lot of new words. I know there are too many words to remember, but you will have to re-watch the lectures again, and 2 or 3 times is more than enough. Myocardial infarction is the heart attack which causes death. That is when the heart doesn't get blood and the cells die, and you get that extreme pain which causes death. It is called myocardial infarction. So this is a very mild heart attack. This is the most severe heart attack. Myocardial infarction, CTION. Clear? So heart को कैसे affect कर रहा है? Clear है? Kidneys. Now you remember glomerular filtration rate. Do you remember those 3 pressures? Net filtration pressure is 10 millimeters of mercury. But the kidneys also require some amount of blood pressure, ना? अगर आपका blood का pressure ही बहुत ज़्यादा है, तो kidneys will also not function properly. It will cause damage to the kidneys. Your afferent arteriole, do you remember? Afferent arteriole brings blood inside the glomerulus. Efferent arteriole takes the blood away. Just imagine that afferent arteriole is bringing the blood with lot of pressure. It will destroy the glomerulus. आपका glomerulus फट जाएगा, and that will be called as what? Renal failure, kidney failure. You remember we have learned this. So kidneys में अगर इतना high रहेगा, तो it will cause something which is called as renal failure. I hope this is visible. Okay. So are you understanding? These are the ill effects of hypertension. So this will not damage the organs to such an extent, but such a high blood pressure, This is extremely high blood pressure. This can damage your organs, and ultimately if it is not treated, then it will cause death. Is this clear? So there are medications which can reduce the blood pressure. Obviously the person has to lose weight, has to stop eating a few things. All those things, if they are not done, it can result in death. Is this clear? So hypertension clear hai, high blood pressure clear hai. Please remember this. Now this is the first disorder. Second disorder related to your circulatory system given in the book is called as CAD. C-A-D. Okay. See, all these disorders are related. If you study hypertension, तो उससे ही related CAD है, उससे ही related angina pectoris. What is the full form of CAD? Coronary artery disease. Now everybody, I am hoping that everybody now knows what a coronary artery is. Okay, so coronary artery disease is called as CAD. Coronary artery disease मतलब क्या? Now just imagine this is the coronary artery. What is the coronary artery? It is the branch of the aorta which opens into the left ventricle. Now what is the function of the coronary artery? It supplies oxygenated blood to the heart. Now just imagine if this artery becomes blocked. So what I will do is I will draw a larger diagram over here so it becomes easier for me to show. This is your artery. The blood is flowing this way. Suppose if the person is eating lots of fatty substances. If he is very obese, obese means very fat, then what will happen is to some extent fat body में store होगा, लेकिन extra fat जो है वो blood में circulate होते रहेगा. जो भी चीज आप extra खाते हो वो blood में circulate होगा. So what will happen is slowly over a period of time fats are sticky also. Fats will begin to build up over here. They will begin to build up inside your arteries. And suppose अगर ये आपका coronary artery है तो what will happen? Slowly the amount of fats which are deposited, they will increase. So are you getting what I am trying to show you? The diameter of the artery is reducing. So this will cause an increase in blood pressure. And if this is not checked, अगर इसको stop नहीं किया, if this is not treated or if it is not stopped or if the person who is having this trouble, he doesn't put a control on what he is eating, then what will happen is there will be a time when this entire artery will be blocked by the cholesterol or calcium salts or fats or fibers. And now when the entire artery is blocked, which artery am I talking about? I am talking about the coronary artery. Just imagine this artery is supplying oxygenated blood to the heart. उसको ही आप block कर रहे हो. The heart will not receive any oxygenated blood. Heart को ही आप oxygen नहीं दे रहे हो. Heart pump करेगा क्या? नहीं करेगा. So coronary artery disease is a disease in which your coronary artery gets blocked. See, if it is slightly blocked, blood will still flow. You will have high blood pressure. And because when people have coronary artery blockages, there are many ways to remove this blockage. I am not going to go into that detail. But if this is stopped over here, that person can survive. But if it is not stopped, then this disease will completely block the artery. And when the artery is completely blocked, what will happen is it will result in a heart attack, which is called as myocardial. Again, I am writing down the word infarction. So myocardial infarction is when the heart doesn't receive oxygenated blood या बहुत ही कम मिलता है, उससे वो काम नहीं कर सकता. When your arteries are slightly blocked, you will have slight pain when you are running or jogging. That is called angina pectoris. Angina pectoris goes away with rest. Okay, so is this clear? Coronary artery disease clear है? Artery block हो जाता है. Now, if the coronary artery is blocked due to fats or cholesterol or calcium, then the condition is called as what? It is called as athero. Remember this? Sclerosis. Sometimes what happens is the artery gets blocked by itself. The person is not eating unhealthy stuff, the person is fit, but sometimes what happens is the lumen itself of the artery becomes narrow by itself. Naturally हो जाता है. So the walls might become thick and it might increase the blood pressure. So this condition is called as what? Arteriosclerosis. You remember? So please remember the difference between arterio and athero. Athero means fat causes the reduction in diameter of the artery. Arterio means naturally the artery diameter is reducing. Is this clear? Done. So coronary artery disease clear. The third disease in your book is called as angina pectoris. Angina pectoris I have already explained enough, but let us have a look at it again. Okay. So next is angina pectoris. It is also called as a mild heart attack. Okay. Normally people suffer slight chest pain initially, then they are hospitalized, then they recover. So that pain is called as angina pectoris. So if you are getting this pain and if you rest now, if you lie down on a bed, this pain will go away. Again, why does this happen? Same reason. Your coronary arteries are partially blocked. So the diameter has reduced, so the blood pressure is increasing. Blood to the heart is reducing. Because the heart is getting less blood, there is pain in the chest. So see, there is a system in your body. If the heart is getting less blood, the body will tell you. So there are pain receptors, और वो pain receptors में pain होने लगता है. So वो आपको मैसेज दे रहा है कि heart को blood कम जा रहा है. If there were no pain receptors, you would not know that your heart is getting less blood and you would die. Is this clear? So जब heart को कम blood मिलने लगता है, मिल रहा है blood लेकिन कम मिल रहा है because of blockage of arteries, not complete blockage, partial blockage. That pain is called as angina pectoris. Angina is pain, pectoris is chest. Now how do you know if you are having this pain? What are the symptoms? So mild chest pain, then there is squeezing or tightness in the chest. Okay, so you feel as if there is a lot of pressure. You just imagine you are sleeping and somebody has kept 4 or 5 kilos of things on your chest. That pressure, such a feeling you will get. Then the pain may also be on the left side of your neck. Okay, you might have pain on your left side of the neck, left shoulder, left upper arm, left side of the chest. All these are symptoms of angina pectoris. Also jaw, आपके left side of the jaw में भी pain होता है. So pain in the left jaw, pain in the left side of the neck, pain in the shoulders, or tingling sensation in the shoulders. Okay, tightness in the chest. All these are symptoms of angina pectoris. And if you just lie down, stop whatever you are doing and take rest, your heart rate will reduce because your heart is not needed much at that time. These symptoms will go away, and obviously then people have to take treatment, they have to follow a diet so that this doesn't occur ahead. If this is not treated, your arteries will soon become completely blocked, and this will result in what? Fatal heart attack, which is called myocardial infarction. So I am writing this word so many times. Why? Because I want this word to be ingrained in your mind. आपके ब्रेन के अंदर ये फिट हो जाना चाहिए वर्ड. आप समझ रहे हो ये? So is this clear? So we have completed with angina pectoris. Now the next part in your book is about angiography. So there are 3 parts which have been deleted. Angiography has been deleted, heart transplant has been deleted, and silent heart attack has been deleted. I will try to make a separate video on that if you are interested, but it is not there in your current 12th standard syllabus because of the COVID situation. So we are not going to study those 3 topics. Directly what you have for your 12th standard now is ECG, which is going to be our last part for today. Okay, so I hope everything that I have taught up till now is clear. We started with what? We started with measurement of blood pressure. We studied how the syphgmomanometer is used, what are the parts of syphgmomanometer. Then we studied the diseases. We studied hypertension, high blood pressure. Which organs does it affect? What is extremely high blood pressure? Then we studied coronary artery disease, CAD, and how it causes angina pectoris. Now we are directly going to ECG. Okay, this is the last part for today's lecture. The full form is ECG is electrocardiography, or it is also called as electrocardiogram. Now, first of all, what is ECG? So in your book they have given a very confusing definition. If you see your 12th standard Maharashtra State textbook biology, then if you read the definition for ECG, you will become confused. What is ECG? See, in simple words, your heart is being controlled by a conducting system. You know that. The conducting system is called as what? nodal tissue, do you remember? SA node, AV node, bundle of phase, left right bundle branches, Purkinje fibers, they are called nodal tissue. How do these nodal tissue components work? By sending electrical signals. So what this ECG is doing is, it is basically measuring this fluctuation in electrical impulses. ये जो changes आ रहे हैं electrical impulses में, वो ये measure कर रहा है. But these electrical changes are occurring inside the heart. So obviously, since they are electrical impulses, they also pass from the heart to the body and from the body to your skin surface. तो आपके स्किन के ऊपर भी वो इम्पल्स जा रहे हैं, बट दे आर वेरी वेरी माइन्यूट इम्पल्सेस, यू कैन नॉट फील देम. सो यू रिक्वायर अ स्पेशलाइज्ड मशीन which can detect those electrical impulses from your skin and it can amplify them. What is the meaning of amplification? वो impulse को बड़ा करना, so that आप उसको measure कर पाओ. Is this clear? So ECG machine or an electrocardiogram machine basically detects those electrical impulses which are sent by the heart and which travel through your body surface and they are on your skin and those are read by this machine. Is this clear? So that is the function of ECG. Now, what are the components? So first of all, there is a main machine which is called as the ECG machine, which is also called as the electrocardiography machine. And to this ECG machine are connected different electrodes. Okay, electrodes are wires which are connected to your body. So one end of the wires will be attached to your arms, your legs and your chest, and the other end of the wires will be connected to this ECG machine. Now, how many electrodes are there? There are, in your book they have given 10 electrodes are used. Now pay attention. 4 electrodes or 4 wires are connected to your limbs. Okay, which are the limbs? So you have 4 limbs and hind limbs. So every limb के ऊपर आप एक एक इलेक्ट्रोड अटैच करोगे, एक राइट लेफ्ट हैंड पे, एक राइट हैंड पे, एक लेफ्ट लेग पे, एक राइट लेग पे. 4 वायर्स अटैच्ड है. So 4 electrodes. Then you will take 6 electrodes and these are attached to your chest. So 6 electrodes are attached to your chest because most of the impulse will be present in this area. So these 6 electrodes will detect those electrical impulses sent by the heart from your chest. And these 4 they will detect the impulse sent to your arms and legs. Obviously those impulses will be weak. इधर वाले impulses ज़्यादा strong रहेंगे, limbs वाले weak रहेंगे. And together all these electrodes will take the impulses into which machine? This ECG machine. And how will you come to know what is happening, how your heart is working? So there is a display to this machine. And on the display if you see, you will see these kind of structures. This kind of a display you can see and it is called as an electrocardiograph. So some of the machines you can see it on the display, some of the machines you can also print it on paper, that is called as electrocardiogram or electrocardiograph. Okay, and then so if you go for a ECG test, they will give you that paper and you can save it, so for future use you can refer to that paper. And on that paper this pattern will be shown. These spikes are caused by electrical impulses. जहाँ पे impulse ज़्यादा है ये ऊपर जाएगा ग्राफ, जहाँ पे कम है नीचे रहेगा. Is this clear? So I hope ECG is clear, the machine is clear, and this electrode parts is clear. Now we have to basically study this ECG graph. Most important part of ECG is the ECG graph. Lot of questions are asked in the exam. Diagrams also, short notes also, so now pay attention. Okay. Now the ECG graph. So what should I do? Should I use a red pen? Okay, चलो red pen से करते हैं. Okay. Now this is the graph like this. This is your y-axis, this is your x-axis. Obviously x-axis is time. And this is the electrical impulse which is measured in millivolts, MV बोलते हैं उसको. So you can see that the graph increases whenever the millivolts increase. Okay. Now, this first spike is called as P. These are again given letters. This is Q, this is R, this is S, and this is called as P. Now, let us study what this ECG is. This entire thing is called one cardiac cycle. ये जो पूरा पार्ट है इसको बोलते हैं एक cardiac cycle. Again the same thing will repeat. Okay. Now, three things are happening. Okay, cardiac cycle में what all things are happening? First thing that is happening is atrial systole. Atrial systole is atrial contraction. So this part is related with atrial contraction. This part. Then what is happening? Ventricular systole or ventricular contraction. This part is related with ventricular contraction. And this part is related to ventricular diastole, that is ventricular relaxation. Okay, so there are three things which are shown in the graph: atrial contraction, ventricular contraction, and ventricular relaxation. Abhi aap puchoge where is atrial relaxation, that I will teach you. Now, atrial contraction is represented by this part of the graph, which is called as a P wave. Okay, so atrial contraction is also called as a P wave. P wave is this wave, this part. Okay. Next thing which happens after the atria contract is the atria begin to relax and the ventricles get filled, they will contract. So the ventricular contraction, so I will write down, or I can also write atrial systole if you want. So contraction, or I will write systole is a better word. So atrial systole followed by ventricular systole. So ventricular contraction. Now ventricular contraction is always represented by this area, which is called as QRS-complex. So when the atria contract, that part of the graph is called as P wave. When the ventricles contract, that part of the graph is called as QRS-complex. Obviously here the electrical impulses है, just common sense tells you atria contract होंगे तो उतना इफेक्ट नहीं होगा, लेकिन ventricles are larger, more powerful. When they contract, obviously the electrical impulse will be more. So that is why this graph goes high. ये spike ज़्यादा है इससे. समझ में आ रहा है? यहाँ पे atria है less powerful, ventricles more powerful. Finally, over here we are showing ventricular diastole, which is ventricular relaxation over here. So I am writing ventricular diastole. Deliberately I am using the words systole and diastole. Contraction, relaxation, don't use the word. Systole, contraction, diastole, relaxation. And ventricular diastole is represented by T wave. So very simple. So in the ECG you can show when your atria are contracting, when your ventricles are contracting, and when your ventricle is relaxing. P wave, QRS-complex T-wave. Now the question comes, where is atrial relaxation? Pay attention. As soon as the atria contracts, it will pass the blood into the respective ventricles. As soon as the blood goes into respective ventricles, the atria will relax. So when the atria are relaxing, what is happening is ventricles are contracting. बराबर है ना, एक बार एट्रिया में से ब्लड वेंट्रिकल में गया, वो रिलैक्स कर रहे हैं, वेंट्रिकल में भर गया, फिर वेंट्रिकल कॉन्ट्रैक्ट होंगे. सो द एट्रियल रिलैक्सेशन हैज टू ऑकर समवेयर ओवर हियर. सो योर एट्रियल रिलैक्सेशन इज एक्चुअली समवेयर ओवर हियर. ये यहाँ पे एक ऐसा ग्राफ आता है which shows atrial relaxation, but वही टाइम पे वेंट्रिकुलर कॉन्ट्रैक्शन हो रहा है जिसका इंपल्स ज्यादा है. So this impulse overrides this relaxation wala impulse. Are you getting me? That is why in the ECG you cannot see a separate spike for atrial diastole. You cannot see a separate spike for atrial relaxation because उससे भी high impulse वही time पे contraction का हो रहा है ventricles का. That is why ये इसको override कर देता है. समझा आपको? If anybody asks you why can't you see the atrial diastole or the atrial relaxation spike in the ECG, because it is overwritten by the ventricular systole or the ventricular contraction. That is why I have drawn it in dotted. Normally it is not drawn, so I am rubbing it off. Is this clear? Okay. Now, how do you describe this? So you have to write down the events which are occurring in the cardiac cycle. This is one cardiac cycle. You have to write down the atria contract. It is called atrial systole. Another word now. Systole is also called as contraction. It is also called as depolarization. देखो मैं यहाँ पे words लिख रहा हूँ. Whenever you want to say contraction, you can use the word systole, or you can also use the word depolarization. Similarly, ventricular systole, I can use the word ventricular depolarization. Diastole, I will use the word repolarization. Depolarization मतलब चार्जेस अपोजिट हो जाते हैं, repolarization मतलब चार्जेस पहले थे वैसे repolar हो जाते हैं, तो diastole is called as repolarization. Please remember, so for contraction you can use the word systole or depolarization. For relaxation you can use diastole or repolarization. Normally these words are used for the ECG context only. Is this clear? So if I say which part or which letters represents ventricular depolarization, that means I am asking about ventricular contraction or ventricular systole, then which letters will represent QRS? But please don't forget to write complex. When you are writing about these two things, atrial systole and ventricular diastole, only single letter is assigned, and that is P wave or T wave. Now how do you explain this graph? So first of all you write that the first contraction is the atrial contraction, atrial systole. It is represented by a T wave, and as soon as the T wave ends, now this is your ground. Okay, ये जो आपका surface है, ये आपका level है. This is your level. So what happens is after the atrial systole ends, the graph goes below the ground level, and then it again rises off. So the point where it begins to rise, that is the Q part. The point where the graph has reached its highest peak, that is the R part. And again when the graph falls, the lowest point is called as the S point. Together it is called QRS-complex. So आप imagine करो, ventricles में maximum electrical impulse कब पहुंचेगा जब वो R point पे है. So this is the point where the Purkinje fibers are getting the electrical impulse. So if you want to show this same thing with reference to nodal tissue, then this is happening when the SA node is releasing the impulse, your atria are contracting. Then slowly this is increasing. So when this is increasing, that means the information has gone from SA node to AV node. Then from AV node it has gone to bundle of His. Bundle of His to bundle branches, and when it reaches Purkinje fibers, you get this R point, highest impulse. Then after the Purkinje fibers, the conduction stops, so this will begin to relax, so ये नीचे जाएगा graph. And finally, when the impulse is not present in the nodal tissue, you will have this part which is called as the ventricular diastole or ventricular relaxation. Is this clear? समझ रहे आपको? So that is how you to explain. Please remember depolarization, repolarization. I have drawn this graph. It is not given in your book. Okay. So I hope you have understood this. ये clear है? This is your ECG. Electrocardiograph. Now what is the use of this electrocardiogram or electrocardiograph? All the defects in your heart you can understand by looking at this. Obviously this is not as easy as it looks. It is much more complex. Okay, that is why only doctors can make out from the ECG how the heart is working, but I will give you an easy idea. This is your cardiac cycle. So what is going to happen? Again this will repeat. Again after T there will be after some time P wave, QRX, T. It will repeat. What if I say that the distance between this T wave and the next P wave is small? That means cardiac cycle is happening very very fast. That means the heart rate is very very high. If a person is having 102 beats per minute, तो ये सब बहुत जल्दी जल्दी होगा ना. If a person is having 60 beats per minute, तो उसके T wave और next P wave के बीच में distance रहेगा. Are you understanding this? Common sense. So by looking at the electrocardiogram, you can make out whether a person is having normal heart rate, or is having tachycardia or bradycardia, or higher pulse rate, lower pulse rate. Similarly, This is more or less regular. मतलब कि इसके बाद जो next P wave आता है that is very similar to this. QRS आता है that is similar. But what if the next P wave is more than this or less than this? That means the heartbeat is irregular. कुछ तो problem है. So basically by looking at the electrocardiograph, you can make out whether the heart is doing its job properly or not. If your heart is having some problem in pumping, sometimes there is a disorder called as enlargement of ventricle. Ventricle का size बढ़ जाता है. So all that can be seen through this electrocardiograph. Is this clear? So by looking at your electrocardiograph, the doctor or the cardiologist will come to know if your heart is working properly or not. Is this clear? And that is why this is very, very important. By looking at this, the doctor can come to know whether you are going to have an heart attack or you had a silent heart attack. Silent heart attack is an attack which you don't know it has already occurred. So basically all the defects related to the beating of the heart can be understood by observing this. Is this clear? Okay. So that is the last part of today's lecture, which is ECG. This is very, very important from the exam point of view, sketch and label. Now one more thing, in your book they have labeled some extra parts. For example, they have labeled this part as PR interval. Very, very simple. This distance between P and R. Okay, so actually it is this is called as PR interval. Similarly, this distance is called as QT interval. This distance is called as ST interval. And if there is another cardiac cycle, then this is the P wave, this becomes your QRS. So this R and this R, the interval between these two is called as RR interval. So these are the terms which are used in ECG. They are not explained in the book. Very simple. It is a distance between those two letters. Simple. You don't have to study about that in detail. You don't have it, but it is given in your diagram. Ye clear hai? So this is your ECG part. And with that we complete today's lecture. So we have completed with measurement of blood pressure. We have completed with all the heart related disorders, which were the hypertension, coronary artery disease, CAD, and angina pectoris. And finally we finished with ECG. Once again I will repeat, silent heart attack, heart transplant and angiography has been deleted from this year's syllabus, so I have not taught that to you. Is that clear? In the next chapter we will be starting with the last part in your textbook of this chapter, which is lymphatic system, and we'll be also starting with the part which I have not taught you, composition of blood. And after composition of blood we will finally finish this huge chapter. Okay, so thanks a lot. If you have any doubts, please let me know, and that is the end of this lecture. Okay, thank you.